I think if you talk to people all around the world, Burundi is a place that a lot of people don't know about. It's a wonderful place, but it's an often overlooked place. Kibuye Hope Hospital, where we are right now, is in the rural interior of Burundi. It's had a very difficult history of warfare and want. The result of that is that on almost every development scale, income or industry or education, Burundi is generally pretty significantly behind most of their neighbors.
In our country, we have experienced many civil wars, and that decreased the development, and that is related to the poverty we have in our country.
The hospital motto is work for a God who heals and gives life. This starts from the freedom we have in the hospital to share the gospel, whether it's when we are celebrating with them because God has done whatever healing we see, or when we are sad, to be able to share grief with our patients, but also the hope that we know in Jesus Christ, so that we're integrating faith and healthcare.
Kibuye Hope Hospital was founded here by North American Free Methodist missionaries in the mid-40s, which makes it one of the longest continuous operation hospitals in the country of Burundi. That's well before Burundian independence. There were missionaries here present for years and years, and when wartime hit, it was through the incredibly sacrificial and amazing work of several local Burundians here that were invested in the hospital that this place stayed open and stayed operational and stayed in the hands of the church instead of it being surrendered over like so many other hospitals were at the time. And their stories are incredible.
My name is Gilbert. I am medical doctor and medical director of Kibuye Hope Hospital. What I encourage people to do, our doctors, our nurses, everyone to become a messenger of the gospel. Kibuye is working as a missionary hospital, not only treating physically, but even spiritually.
When we arrived here, the hospital did not have running water. We had major infrastructural needs that were there. So one of the first things that was done was drilling of 2 wells with water distribution systems. In 2018, we started a solar panel field, which was expanded in 2023 to where now there's clean, available power. The volume of the hospital could handle it before we came, but then when we came and the university was more involved, the number of patients started to balloon, and we found that we had patients that were 2 to a bed or 3 to a bed. There were years when the primary projects were building inpatient ward facilities. So we built over 100 pediatrics beds, over 50 surgical beds. We expanded maternity and labor and delivery to be able to accomplish all these things. So all of that has been steps along this path of moving the hospital towards being able to be a university teaching hospital that can provide good and decent basic care to people in this community.
The main purpose of the hospital being in rural areas is, providing good quality care to these communities in rural Burundi. Rural Burundi has maybe 86% of the whole population, yet most of the good quality hospitals are based in the capital city.
This hospital brings a lot of hope for the underserved community.
So we're standing in the site of the new Ambulatory Care and Education Center, where we're going to be building 12 new clinical spaces. It's a huge upgrade for our patients, our personnel, and our students. We've obviously grown a lot, and the last piece of the puzzle is to get the Ambulatory Care and Education Center built so that we can complete the renovation of this site that's been going on for the last decade.
The new outpatient registration, triage, and clinic space will be in some ways kind of a final clinical piece to make sure that we have the ability to welcome patients well into the hospital and in a streamlined fashion bring them to where they need to get care, provide a place for the doctors to work, a place where learners can also be supervised, that is integrated together with the entrance, with the welcome, and also with emergency services if they should need it.
A new triage area will be very important to help have the space that our colleagues in emergency need to orient patients, organize patients, and help us be more efficient.
It is very important to have that triage and outpatient treatment because we need the time a patient spent in hospital. Describe how you are working, how good service you are rendering.
So we're looking at a 120% increase in outpatient facilities, even more than that as far as space. That will enable us to do new things like ENT, head and neck surgery, and dentistry, because we'll just have this physical space to do those. And by designing this space as it is, it also opens up more opportunities in other parts of the hospital as well.
I've lived and worked in Burundi for many years, and there's a constant need for patient care. So whenever I call them a friend, a partner, gives to a hospital such as Kibuye, you're essentially giving towards many patients who otherwise will not be able to afford this. So I really encourage you to consider supporting this project, as it will greatly impact the lives of many in rural Burundi, which, as you might already know, is one of the poorest countries in the world, and the same patients living here deserve great health care as anybody else in the world.